The following is brought to you by VerticalVet. Rethink your GPO.
Hi, I'm Dr. Ernie Ward, Executive Director of VerticalVet, and I am so thrilled to be with you once again today during these quite unusual times. And once again, we are going to focus on an area of clinical practice that is so important to us, and that is the other half or third of our patients, the feline. And so today we've got an expert who's going to share with us some of her tips and tricks and some advice maybe of how we should handle cats differently during these COVID times. And again, I know that our VerticalVet family, we have focused a lot on this sort of next normal. Again, nobody has the answers, but we do know the challenges. And so in clinical practice, we know that felines have often been overlooked for decades. And now during these COVID times, people are even perhaps more reluctant to bring their cat to the veterinarian than ever before. And so today we want to sort of address some of that and get into it. And so today I'm super excited to have representing Provecta 2, which we'll talk about in just a little bit, from CAPInnoVet.com, which definitely check out some of their products line. We have Dr. Leigh Hofmeister. Leigh, thank you so much for joining us.
Thank you so much for having me.
Well, first of all, Leigh, where are you coming from? Where are you right now?
So I'm in Virginia Beach, Virginia. I'm a small animal clinician here, and then I also work to educate veterinarians and also pet owners about parasite prevention.
Okay, so small animal clinical practice. Where did you go to veterinary school? We have to get that out of the way.
I graduated from Ross University in the islands of St. Kitts, which was a fabulous time. And then when I left there, I did my clinical training at Oklahoma State University.
Okay, well, at least you have half a football team there. Ross doesn't count. Go Dogs, as the VerticalVet family knows. I'm a proud Georgia Bulldog. But speaking of bulldogs and cats typically aren't talked about in the same sentence. And that's because, obviously, they have very different needs. And for years and decades, you've heard people like me and others say, hey, cats are not small dogs. And back in the day, 30 years ago, Leigh, we were really trying to focus on the medicine, the surgery, the anesthesia, the diagnostics, right? So when we said cats aren't small dogs, we were trying to say, look, there's different diagnostic algorithms that you should apply, different disease prevalence, and so forth. But today, we're going to talk about actually communication. We're going to talk about actually, how can we get cat owners, cat parents, to come into the clinic. And of course, you did touch on it a little bit. Tell us a little bit about, parasite prevention, just so we can kind of get that going, because that is a big issue that isn't talked about as often as we should.
I think that's so true. And I feel personally as a veterinarian, parasite prevention oftentimes goes assumed. I feel like often we assume that our dogs that are on heartworm prevention and our cats that are coming in, that they know the risks. And we're so busy talking about vaccines and making sure they get their annual blood work and talking about fecal evaluations and potentially they're here for a sick visit. And we're busy talking about that. We sort of forgo that whole parasite conversation. And I feel like, especially now with these COVID times, if a person's bringing their cat to you, that's a big deal. If they're making an effort to leave their home, drive in their car to take their cat to see you, you gotta take advantage of that, and you gotta jump on those conversations, even if the cat is there for not a well visit, even if they're sick.
And Leigh, even further complicating matters, not only is it an ordeal sometimes for cat parents to bring their cat to us, but we're competing now with other sources of information. I guess we call it Dr. Google. And, the reality is people are Googling so much information. They're being overwhelmed by so much misinformation, and I would even dare say disinformation, that they don't know which way is up when it comes to their cat care. And so I totally love what you said there about we overestimate compliance. Back in 2006, we were part of that AHA study, and we were shocked. I think the entire profession was shocked when we started looking at single-digit compliance for like heartworm prevention, flea prevention in our cat patients, and not a whole lot better for dogs. And so this is something that we have to keep focusing on. So today I'd like to kind of jump into another part of this conversation, and that is let's start off by talking why dogs and cats are different. And, one of the things that we were talking about leading up to this conversation is that, you were saying, hey, look, I know you've heard this before, Ernie, but dogs and cats need to be treated separately and uniquely. Maybe expand on that a little bit.
So what I like to think about is the different types of owners. So I see owners that have, maybe one cat, and that cat probably comes to see me every 6 months. It gets its vaccines when it's supposed to. It's on prevention every month. They get blood work every year, And then you have a different type of cat owner, the family that has maybe 5 cats. And potentially, for them to afford gold standard of care for all 5 cats is pretty unrealistic. And then the third type of family you have are the cats and the dogs, which that's me. I have 2 cats and 2 dogs. And potentially those cats don't even come in because they're so busy bringing their dogs to you. And so I really talk to my staff about taking the time to look through the medical record. And if it's a dog that's coming in the clinic, look in the medical record. Do they have a cat? When's the last time that cat came in here? Because you may not have the cat in the clinic, but you have the owner, which means that you have the opportunity to provide the education to encourage them to bring their cat to see you.
And that's a really good point. Some of the people that followed me, 25 years ago, wrote an article where we talked about, hey, when you have your admit, when you have your, when somebody registers at your clinic, and even if they've been there every year, you need to ask them, do you have other dogs and cats? And so part of our annual history, Leigh, over the years was just, do you have any other dogs and cats? Because we would find that people would bring their dog to us, but they had these 2 yard cats, quote unquote, or neighborhood cats or whatever, but essentially they were their cat, but they didn't really know what they needed to do. They didn't know how to do it. And I would stress they didn't know the importance of what they should be doing. So a lot of these cats maybe got a rabies vaccine, at a rabies clinic, but that was it. And so suddenly now, if you can ask at each visit, do you have other cats? What about, is there any cats, that you take care of in your neighborhood? That leads you down the parasite prevention pathway, because if that cat is coming into their backyard and they're being fed or whatever, they're bringing along those hitchhiker parasites, which of course, in this case, I'm most worried about fleas and of course, ringworm and other types of things. But maybe speak to that. How are some of the ways that you found that you can ask that question every time?
So that's such a great topic. And aside from that, even with COVID, I find that the college kids are back. Maybe the college daughter has a cat that she picked up at college that's not in the record. So really remember that these families are blending again. And so even if you really feel like that client, it's so important to ask that question. And in speaking to Provecta for cats, it is sold only through veterinarians, but it's not a prescription product. So if you have that family that's hosting the feral cats in the backyard, and not all feral cats are aggressive, a lot of people can touch them and cuddle them and engage with them, that's a great opportunity for them to be in there with their dog. You say, hey, I got this great product for you. It's going to treat these cats. It's going to make them more comfortable. It's going to limit the parasites that your dog's exposed to. And it's affordable. And it's
right
here. I can give it to you today.
Right. And I'll tell you, VerticalVet family, if you don't think there's intense competition for these products, I can't go a week almost, I'm exaggerating a little bit, a month without seeing a new website catering to people who want to buy these flea preventives. Now, I think they're being oversold and overpriced. In fact, there's a new product out that promises to put the picture of your dog or cat on the same box of the same generic product. I won't name it, starts with an F, ends with an L, for many, many years. But, Leigh, what we're seeing is this intense marketing effort by these online companies. And, these products are not inexpensive. And what I get frustrated with is people then say, but I can get it cheaper online. Well, sometimes they can, and that's fair, right? But what are they getting online? That's where I start to really get separating, the products that you buy online, non-prescription, versus the products that we have. So maybe speak to that a little bit, especially when it comes down to differences between dog products and cat products.
Right, exactly. And I've actually had more than one incident with a patient of mine that purchased over-the-counter flea and tick product. And when they brought it to me, we also encouraged all our families to bring with you all the medicine that you give to your pets at their visit. When they showed up with it, I was like, this box is not even close to like the real box that we show. And I don't really understand what's happening there. And it makes me really frustrated because obviously Google's at our fingertips and pet owners, they don't know, and unless they're really having that conversation with you and you're making a point to educate them, it's just important I find to point them in the direction of a pharmacy that you are comfortable with, because they are going to go online. They are. So if there is a place that they can go that you feel safe, then that's a recommendation I have. Another recommendation I have is to limit your products in the clinic to things that you truly believe are going to work. Do not carry 20 different flea and tick products.
No.
Do not carry 30 different heartworm products. You need to carry a very, very limited supply so that they know exactly what your recommendation is, and that you feel strong about recommending those products to your pet owners.
Right. And we've talked about this, again, Vertical Vet family with inventory management. I mean, you can't carry a multitude of SKUs, especially amongst these types of products. But again, getting back to that, what I find so frustrating, and I know we've talked about this here on the show for other, people that have watched, but Leigh, one of the things that's frustrated me for the past 20 years is the pet owner, well-intentioned, trying to do the right thing, caring, compassionate, but they think that the flea preventive is also protecting against like heartworm disease and things like that. And so suddenly now you've got that dog, and I know we're talking about felines today, family, so just bear with me, but you have that dog that comes in and suddenly it pops up positive on that ELISA test, and they're like, I've been given the medication every month, just like you told me. And turns out it was only a flea and tick product. So again, I my own personal belief, Leigh, is that if you're going to take the effort to spend this time, put this product on your cat, however you administer it, get as much coverage as possible. Protect your cat as much as possible. So, I mean, does that factor into sort of your decision making of the products that you choose for your clinic?
Oh, absolutely. And I will tell you, for cats, we carry a product like Provecta or Paradefense. We obviously also carry a heartworm product for cats because that is hugely important, even in indoor cats. But it's not realistic that every single cat owner is going to be on Revolution. And I have explained, I feel like, till I'm blue in the face about how mosquitoes can get inside and how cats can get outside. But you're either going to have that client on board or you're just not, and then they're going to leave without anything. And so I feel very strongly that they should leave with something. And Provecta is a great product because, like I said, they can get it from you. They trust you. They're coming to you for a reason. It's affordable. It's a tiny little amount. You're not dousing your cat in, topical prevention. And you know that they're protected from fleas. And that's such a burden for cats too. I mean, I can go down that road as well, but they are so hard to diagnose. And you have cats coming in with several behavioral problems, skin problems, they're vomiting. And potentially it could all be due to the stress of the fleas. And not to mention the stress that they're under from COVID anyway, with everybody being home and everybody under one roof. I mean, I think we all know cats are like, I'm all done now, Well,
and that leads me to the next thing I did want to talk about, and that is the specific and unique impact that COVID-19 has had on cats. Now, on our show here, the Vertical Vet family, if you haven't checked these out, we've had behaviorists on here, multiple times talking about the impact of dogs and cats and when people are at home and when people are going back to work. I mean, so we've really tried to cover that ground quite thoroughly. Having said that, it always is worth revisiting. And so, what have your experiences been as far as like some of the unique challenges that cat owners have faced with COVID-19, pandemic, shutdown, lockdown, quarantine, you name it, it's a disruptor.
It is. And I think, number one, people are struggling to give their cat alone time. I think the human-animal bond I think we've all seen how important that is through these pandemic times. And we want to be there with our animals, especially those families that are, solely cat owners. But potentially the cats are just not into it all day long. And so I've tried to encourage people to just leave the house, even if you can take your conference call outside or drink your coffee outside. Give them some space. If it's a family that has children, really try to focus on, we need to let the cat have quiet time now, help them understand, because I'm so worried about cats. I feel like I've seen a lot of sick cats during this time, and I do think a lot of it is stress related. And I try really hard to have a conversation with every owner that I speak to. Like, what's your life like? Are you at work? Are you home? Are the kids home? What's going on? What's the schedule? How have things changed? And they don't really necessarily pick up on that unless I ask them. Right. So oftentimes that's the first time they've heard about it. So, thinking about, again, they're coming to you for a reason. And I think as veterinarians, we talk all the time about how we're treating the owner often and not always the pet. And this time we really need to educate them about the pandemic, about what their cats are seeing and what they're feeling. And not all cats are mad that we're home, but all cats still need a break. So definitely make sure you have that conversation.
Yeah, it's an important conversation. And again, Vertical Vet family, if you haven't had a chance to check it, we did a couple of interviews with the veterinary behaviorist and dear friend Gary Landsberg, who we really went to a deep dive on some of these strategies. It's not too late. You know, it was funny, Leigh, I was talking to this veterinarian, they're like, well, the pandemic's basically over. And I'm like, I hope that would be great. I just don't know that I live quite in that universe yet. But so if you're out there right now in practice and, you know, we're all adjusting to curbside and just this extraordinary times, you know, really take the time to have these conversations, ask people about it. Like Leigh just said, the reality is most of them aren't really cognizant that their cat is feeling stressed, right? I mean, it goes out and hides under the bed or under the couch or whatever. And that may be an early signal of you know, problems. What about compliance during, you know, COVID times? I mean, certainly we've talked to a lot of veterinarians, not only here, but, you know, on my podcast and elsewhere, they're seeing a big, tremendous drop in cat visits. Dogs seem to be doing really well, but cats are suffering. Any thoughts on that?
I've seen a lot of sick cats. I can't really say that I've seen an increase in well visits unless it's a new cat. And again, I kind of go back to if you're seeing a dog during the pandemic, do they have a cat at home that needs to be seen? You know, if you're having an increase in dog visits, do they have a cat at home? You know, have that conversation and you know, how are your kids doing? Oh, my daughter, you know, adopted this cat. Actually, I meant to talk to you about that. And really just, I feel like during this pandemic, people just need each other, and people have a special relationship with us, and coming to see us and having that conversation, gosh, they just love it. They love hearing how we're doing during COVID. They love having the chance to talk about what they're going through. And I think that's an important way to increase compliance. I also think that if for whatever reason you're not on social media, you got to get there now because that's all anybody is doing. And we are still curbside. I'm sure most clinics are. I feel like curbside I was very afraid of it, but now I love it because they're not sitting there on their phone having a conference call. They're talking to me. They're spending they're giving me their undivided attention in their car, which is awesome. That's not always the case. There's kids running around the exam room, the dog's barking, the cat's hissing. It can be kind of chaotic, and they're not really listening to everything you're saying. But during curbside, I feel like they are. And so I think that's a huge opportunity too. And then, of course, getting your staff on board, because you as the veterinarian should not be the first one making a recommendation. It should be the second or third time they're hearing that. So if they're on your social media channels and, you know, maybe you offer giveaways. I mean, I think social media is huge right now, as well as telemedicine. I mean, that's another thing to talk about too, especially for cats.
Yeah. And definitely, again, if you haven't had a chance to check out those things, we've talked, you know, in the early days about how you can, you know, improve your curbside service. And some of the things, I agree with you, Leigh, there are tremendous opportunities baked within this crisis, if you will. But, you know, so again, if you haven't watched some of those videos or read some of those articles that we provide to our Vertical Vet members, please check those out. The other thing too, I think that she mentioned, you know, is telemedicine, telehealth. We've covered that with a lot of different experts. We had a lot of different companies on. So I still feel strongly that we need to be engaging more via telemedicine, but we're not. So we're working on it. So professionals out there, listen up. Now, I do want to switch to a little bit. You know, you mentioned that, okay, when they are there, wow, we should be so grateful. This is a tremendous opportunity. Maybe people are focusing. But what are some of the other tenets? Like, what are the things that you're loading in or baking into those feline visits? And now let's focus on the wellness, which I know you mentioned you aren't seeing maybe as many as you'd like, which I think is true all across the nation. We're seeing more sick pets. But the reality is, when you do show up with your cat for their annual whatevers, what are some of the things you're doing to ensure success?
So I'm actually a fear-free certified veterinarian, and I feel very strongly that if we can engage in that and show clients what a great experience that is for their cats, they're more likely to come back to you. So specifically with curbside, I have my staff take a blanket or a towel that's covered in pheromones. They go out to the car and place that over the carrier. So that limits, number one, visual stimulation for that cat, potentially dogs that are running around or people walking and, you know, horns honking. And then they also have the calming effect of the pheromone. And they come right into the exam room. We have a cat only exam room. I also think that that's a huge thing to recommend, even with COVID. Try to keep the cats. If you're not seeing that many, it should be easy to keep them all in one room. And then we offer, we have whipped cream, we have olives, we have all the fun treats for them, microwaved baby shrimp, just to encourage their participation. And then I take pictures. I send pictures to the client. We have an iPhone that belongs to the clinic, and I'll just snap pictures and show them that their cat's playing with a feather toy or the cat's eating a treat. They love that. And it makes them feel connected to the visit since they're not in the clinic anymore. We do offer FaceTime. A lot of people don't want to be on FaceTime for the visit, but we do offer it. And then, we'll always post pictures on social media, which people love having their pet featured on their veterinarian's social media. So all of those are ways to help the cat have a good time and also include the owner. I also want to say that it is a very streamlined process for cats. We get them in, we get them out. There's not a whole lot of waiting around unless, of course, they're ill. And so trying to make it quick, fun, and engage the owner through, iPhones and such is really helpful.
Yeah, I love all of that. Those are great tips. And again, definitely check out, what we've done here. A lot of that stuff, I think, it's so important and critical to our success. But I do want to also spin into, why we're here today, which is to talk about Provecta 2, and that's felines and fleas, because you kind of hinted earlier, but I think most of us know that have been in the profession for any length of time that it can be nearly impossible to see like a live flea on a cat, right? They're fastidious groomers, so you're just not going to see, like in many dogs, you just kind of run your fingers up the bridge of the tail and wow, there's fleas popping. So what are some of the things that you do in your clinic, whether it's through social media outreach, during appointments or whatever, to encourage, educate, and promote like flea prevention for cat owners specifically?
So I really go back to the flea life cycle. And like you said, it's like a gold mine if you find a live flea on a cat. But really making owners understand that that's only 5% of the problem. The other 95%, which is microscopic and you don't see. And I really just try to gross them out, to be honest, talking about the eggs and the larvae and providing that education, because I don't think people always understand really the life cycle of a flea, and that a flea can lay, 50 or 100 eggs in a day or two, and that really grosses them out. And then when you kind of take the step to say like, hey, if your pet's covered in parasites, that's a stressful event to them, and cats, they get stressed, here we go all the way down the road. They're urinating outside the box, they're defecating outside the box, they're aggressive, they're hiding. And oftentimes people will spend a lot of money working that up when in reality it was a parasite problem.
Yeah. And we live in the South, so we see this a lot. And I will say I do get frustrated with some of my, colleagues in the Northeast and in the Pacific Northwest. And they say, oh, it's just not a big problem. I don't know that I always buy that. I think they have more seasonality. You and I know that flea season is year round where we live. The other thing too is I love the stressful component. One of the analogies I used to use years ago, and again, we're from the South. Grew up in Georgia, live in North Carolina, my adult life. We used to say, have you ever been in a bedroom trying to sleep at night and you hear the buzzing of a mosquito? Well, that's like one mosquito and it can keep you up all night. Imagine if you're an animal, a cat, a dog, and you had this thing that was crawling around on you and just taking bites every now and then. Wow, how frustrating that would be. You can't get it. And so what if that was every day, 24/7, and that's really what your cat is experiencing now? So find your analogies, find your stories. I love the metaphors. We really have to tell people stories to put it in relative terms, like Leigh is saying there, because, sometimes gross works, right? I mean, we've had some success in the past decade with tapeworm initiatives that really kind of leaned into that's gross, right? So I think there's definitely an opportunity there. Stress, I think one of the advantages of the coronavirus is people have been in closer proximity to their cats. Therefore, they're observing their behaviors more closely. And I think this is also a way to say, look, these are some subtle signs of stress that you may be missing, So I think it's really important, whether it's hypervocalization, whether it's excessive grooming, whether it's irregular eating habits, all that kind of stuff. I think it's really important to key in. So obviously, Provecta 2 is veterinary exclusive. And I think that's really important from a positioning standpoint. I think that when vets try to sell products that you can go buy at Walmart or that you can find on Amazon, I think that's I believe that is a strategic mistake. Would you like to speak to that around the strategy around that?
I agree with you. It bothers me, to be honest, that there are products out there that people can get over the counter, because I often think that many of those animals aren't getting an exam really ever. If they can control things they see, like fleas, easily by going to the pet store or going to Amazon, why do they need to come to the vet? Of course, we prevent and we treat things that they don't see. And so I just get so frustrated, because I feel like there's a huge education gap there. I mean, I want to educate people and make them understand. And I also understand everyone's on a budget, which I go back to the coronavirus. I feel like people are more open, and it's so much easier for them to say, like, I can't afford that today, or I have $200 to spend today, because they can blame it on the coronavirus. Whereas before, maybe they weren't so willing to come forward that way. And that's why Provecta is so great, because, it's an option for cats. It controls the fleas and the flea life cycle. It's easy to apply. It's affordable, and they can get it right from you.
Right. And this,
all of those things are great.
And there are tremendous cost pressures. And Leigh, I appreciate you leaning into that, because so few veterinarians are comfortable talking about fees or money in general. And I think that, for the way that we've always practiced and positioned products in our clinic is similar to what I think you're saying. And that is, there's a gold standard, right? So there's this perfect product or nearly perfect products, and it may cost, Y. Okay. And that may meet 20% of your clientele with cats, right? So they may say, yes, we can afford to do that. We are willing to do that, blah, blah, blah. But there's a big, wide swath of 80% of your clients that are going, that's a little bit too much for me. And this is where, as veterinary professionals, we have to be willing to make concessions. We have to say, okay, what's our budget? What are we working with here? And then finding a solution. So I think if you're looking at your inventory stack, you probably need to look at maybe 2 or 3 layers or tiers of pricing for these products. And then, like she said, just passionately believe in it. Say, look, yes, we are totally with you, Mrs. Smith. We understand the financial pressures right now with coronavirus, and you're worried about your husband's job or whatever the story may be, right? And then you say, so what we've done is we've really found the products that we trust and believe in. We have high confidence in this, because there's a lot of stuff on the internet that's for a couple of dollars less, you get nothing, So for us, we'd rather you spend a couple of dollars more, and we're literally talking $2 or $3 more, and you get something that we trust as a veterinary professional. So I think having that confidence, having that passion, and being willing to make, as I've said for 30 years now, you must make specific recommendations. You cannot say, your cat needs to be on a flea preventive. You can't say that. That does no good to anybody, because then they go home and they go to Google and they're like, okay, that means nothing. So you need to say, your cat needs to be on Provecta 2, and here is why. And then let it lay, right? Back in the day, Leigh, probably 20 years ago now, when I did my first communication talks to veterinarians, I used to always say, what we're most uncomfortable with is any silence. And so I said, there is power in the pause. I used to call it the power of the pause. Lay out an offering to your client, and then let them process it and give you an answer. But what happens is we just continually talk. We talk over them, and the scenario goes like this. In this situation, Leigh, I'm sure you've been there thousands of times, like me, where you're like, we recommend Provecta 2. It's $6 a month or whatever it winds up being, right? But does that sound okay to you? And instead of pausing, we feel nervous. Oh gosh, what if they reject us? What if they say no? Oh gosh, I'm really conflict averse. We don't like rejection, so we fill the space and we never get to the answer. So it's an important talk. But any tips on talking about money specifically as we kind of get near the end of today's conversation?
Yeah, it's not my favorite topic. My husband will tell you that. But I have gotten more comfortable with it. In my clinic, we try to separate the veterinarian from that conversation. But with COVID, sometimes we're thrown into it, especially with, a sick patient or someone that's on a budget. We're kind of going back and forth. And I just get annoyed. I said, if that were me, I would not want to talk to the vet and then go back to the staff member and then talk to the vet again and then go back to the staff member. So I just buckle down and I'm like, hey, here it is. Tell me what you can do. And I think if you are open and they don't feel attacked and they still feel like they're doing the right thing for their pet, or maybe you can space it out. Maybe they just get, one dose of something today and you can schedule schedule them to come back to get the other dose when they get paid again. And I just think the biggest thing, as with most, is communication and being there for them and being understanding, and blame the coronavirus. Say, hey, I know a lot of people are out of work. What can I do for you today? What works for you? How can I help you get the best care for Fluffy today?
Yeah, it's kind of funny. Back in 98, 99, we started our first sort of, I guess that was the first iterations of the wellness programs back before it really was a thing. And we called them kitty care and canine care. And we identified very quickly, in fact, my wife was really the prescient one on this topic. And I know some of you have read some of my articles on this back in the day, but we knew that the budgeting was a big deal. And so at that time, this was when heartworm and flea preventives were just starting to go to these 6 months packs, right? So suddenly now this was very convenient for us. We were able to generate revenue, but for a lot of clients, that was a big spend, especially think about it in the context of 98, 99 timeframe. And so, we started selling single doses and doing on an auto ship, which was a tremendous burden on our staff, because by auto ship, we mean that our receptionists were mailing out envelopes with single, heartworm and flea preventives. But it was a huge success. And so I think that if you look at what's happening online now, these monthly auto ship products are just going off the rails, because people are like, oh my gosh, this helps me. It's only because they really present it, Leigh, as it's $6 a month. It's $8 a month, and people are like, I can get my head around that number. Well, let's kind of talk about this, and this is about compliance, and I would really insert the term adherence. So how do we get people to follow through with our recommendations? So what are some of the tips and tricks and advice that you would have for viewers today on adherence and compliance to your recommendations, whether it's flea preventive, heartworm preventive, vaccines, or diagnostics?
Speaking to topical preventions in cats specifically, I just put them on the cat for the owner. And I find that small task means a lot to them. They hate having to catch their cat and put something on their cat. It drives them nuts, And so if they happen to be here and they decide to go through with whatever recommendation I make, I just do it then. I do it all then for them. And then with any sort of, like you said, vaccines, heartworm, I think social media is hugely important. And I think we specifically talk to our clients about how they like to be reached out, either through email or text or phone call. And some people just prefer a text, which is so nice. We also have an app, and so they can kind of go in and it alerts you, like, thank goodness, I'm probably the worst pet owner ever. I can't remember to do anything. And so the app will alert me, hey, so-and-so's due for their flea and tick, so-and-so's due for their heartworm pill, and that's so helpful, because I work 2 jobs. I'm a mom of 3 children. I can't remember everything, and so having your front desk staff find a way that works with each pet owner to communicate to them, to remind them. We all need reminders all the time. And I think that's hugely helpful. And then following up with education through social media, I've even had friends that say, like, hey, my dog's due for vaccines. Like, do I really need to come in? I don't really want to do it. And I'm like, I'll bring the dog for you. Like, let me go to the clinic today and set up an appointment. What works for you? And so I know that they're worried about their pets, and I know that they want them to stay up to date, but they're also worried about their health. And we posted a whole video of how curbside service works at our clinic, just to make sure people understand that they are safe, our staff is safe, and we're doing the best that we can to keep everybody safe, but also keep your pets up to date. I really don't want to be dealing with heartworm disease 6 months from now. So, we need to be educating.
Yeah, I agree. I think one of the keys to adherence to any recommendation is reminding people. And one quick tip, I think often we make assumptions on our client's ability to insert things like reminders. If you've got a client in front of you this week at curbside or however, and they're over 60 years of age, do this simple tip that we started doing when the first iPhones came out. Offer to put a reminder in for them. You'd be surprised how effective that is and how appreciative many of those clients are. And they might actually learn then how to do that for their child's birthday or whatever. Chances are their children already entered it in. But you know what I'm saying? It's like, what can you do to remove the friction between giving something, because adherence really is sort of this formulaic, thing that says, how easy it to do, how expensive is it, and what are the benefits to me? It's kind of like the value chain. But the reality is, every barrier that you insert along that chain is just one more chance for it to go off. And so suddenly now they forgot. And honestly, if a cat owner forgets to give a flea preventive for 1 month, it's really easy to forget it the next month. And before long, you're like, I haven't seen any fleas. And you're right back to square one. So it's really, really frustrating to me.
I agree.
All right, so today I want to kind of finish up our conversation talking about the importance of staff because, I mean, obviously this is what I'm known for, staff training, going back to the early and mid 90s. I think that still today we don't leverage our staff enough. You've already mentioned a couple of times about saying, look, there's a real important communication link here that the more people hear the same message in a consistent fashion, my saying of consistency creates credibility. That's what I'm talking about here. So what are some of the ways that you create that consistency so that your clients feel like it's a credible recommendation?
I think, first of all, you need to always work as a team, and that includes the front desk staff, the assistants, the technicians, and the doctor. And it's just really important, even as a veterinarian, I think we all just want to go in and do our exam and have limited, discussions with the owner probably. I want to say when your staff is getting frustrated, make sure you step in. It should be like this constant circle of teamwork. And, my poor staff, I feel like during curbside, I'm loving it. And they're like, oh, we're getting the brunt of everything, because we're the ones out there. And so, if they're tired or they're exhausted, I just go out there. I'm like, I'll take the cat and the carrier. I'm not above that. I was a technician for years before I became a veterinarian, but again, with the education, the front desk staff can take the time to look in the medical record. They can be the one when they're making an appointment for the dog, say, hey, I noticed I'm seeing the Fluffies on here. We haven't seen her in 3 years. How's she doing? Do you need to talk to the vet about her? And maybe even just put in an alert that says they don't want to bring Fluffy in right now, but A, B, and C is going on. Or, hey, by the way, they have a cat. Or, hey, by the way, I know this person. They're my neighbor. Their daughter's home from college. She has a cat. And then, carrying that knowledge through to the next person, the technician or the assistant that's going to be face to face with the owner, and then coming together to speak with the veterinarian about all the variables there. And then us being the final person to really follow through with the recommendations. And like you said, make sure the reminders are in there, make sure that you kind of feel them out and what would work best for them to kind of continue the best care for their pets. Yeah, and keep them coming in.
It's kind of funny. You just reminded me back in the day, I was in practice back when this movie called Ace Ventura Pet Detective. It's a funny Jim Carrey. But I remember I actually used that to train my staff during our weekly things. I said we need to become pet detectives because, you've mentioned this multiple times and it really bears emphasizing to you out there. It is you need to discover what else is happening in their life. You need to discover, do they have other pets that they care for? And again, care for is a wide definition there. But, those are the things that really do help drive compliance, adherence, but more importantly, patient care and well-being. Because if they have 2 lovely labs that sleep in their bed every night and they've got 3 yard cats, well, guess what? The diseases that those yard cats potentially encounter or contract can directly impact their dogs, which then, of course, could impact zoonotically to the people. And so I just don't ever give myself a break from being a pet detective out there and trying to figure out, ways of uncovering some of those other areas that disease and parasites can travel into. I'll tell you, this has really been a fascinating discussion. Where can people find out more about you, about Provecta 2?
So for me, I'm passionate about client education, and I started a blog, myvetandme.com. It's designed for when they do go to Dr. Google, they go to me, and I recommend that they go to you. So I cover a variety of topics on there. I'm on Facebook and Instagram. And then, of course, Provecta, our product for cats. And we do have products for dogs. You'll find more about that on CAPInnoVet.com.
Yeah, it's fascinating. So definitely check it out. My Vet and Me, My Vet plus me. Sorry.
And the word and.
Gotcha. Yeah. MyVetandMe.com. So definitely check it out. I've seen you on Instagram, of course. You're pretty active there. So if you aren't following her there, definitely check it out. But, this is an important conversation, regardless of pandemic or not. Felines need more focus. This is something that, years ago, I think a lot of us were really lamenting the fact that we weren't seeing as many cats. There are some great organizations. I believe we were the first feline-friendly practice in North Carolina back in the day. That's a fantastic group as well. So if you really want to focus on cats, I would strongly recommend, becoming a cat-friendly practice for sure. But again, Provecta 2, check it out, CAPInnoVet.com. They've got other products. In fact, they have Provecta Advanced for dogs, but it contains a permethrin, so obviously that and cats don't mix too much. Dr. Leigh Hofmeister, all the way from Virginia Beach, Virginia, surf capital of the East Coast, so they say. It's really been a pleasure talking with you today.
Oh, thank you for having me.
All right. Well, listen, Vertical Vet family, that's it. We've done it again. We've brought you a very, very entertaining and educational guest, Dr. Leigh Hofmeister from CAPInnoVet, talking about Provecta 2. Definitely check them out online. Check her out on My Vet and You. Definitely check her out on Instagram. She's super active, has some fantastic resources that you can share with your clients. If there are topics that you want us to talk about here at Vertical Vet, definitely just hit us up. You can message us here below, or you can send us an email, however you want to touch base with us. VerticalVet.com, where we have not only some public-facing materials, but we also have a lot of exclusive things just like this. So on behalf of our entire Vertical Vet team, I am Dr. Ernie Ward. It has been my pleasure to spend this time with you. Thank you, and stay safe out there. Give your pets a hug. Bye.